Kenya says its health workers would be among the first participants in the COVID-19 vaccine trials. Kenya joins South Africa, which is among 8 other testing grounds on the continent. The African Academy of Sciences says only 2% of clinical trials globally for all types of vaccines take place in African nations. Correspondent Robert Magila has the story.
These are the people that will be among the first participants in Kenya to take part in clinical trials for a COVID-19 vaccine being developed by AstraZeneca in partnership with Oxford University. The trials to be conducted by the Kenya Medical Research Institute and partners will recruit close to 400 health workers along Kenya's coast and are scheduled to begin later this month, making Kenya only the second country on the continent after South Africa to take part in vaccine trials.
Having a local group participate in these studies will help inform whether this vaccine is for us. Does it require any modification? Is it going to do harm?
Health workers are being prioritized due to their high risk of exposure to COVID-19. In June this year, the government announced over 450 health workers had tested positive for the virus. Dr. Peter Munyu says the success of the trials will depend on a number of factors.
In step 1 and step 2, they are looking to see whether it is safe, and secondly, whether it is going to create the resistance that we are looking for, or what we call immunogenicity.
Those we spoke to on Nairobi streets backed the trials in the country.
We are contributing in our own little way, and we shouldn't be complaining so much about that thing.
The way things are here, we should try anything that helps us. I don't think it's a bad thing.
I will not refuse. If it's successful, we will be among the first to get the vaccine.
With more than 1.3 million COVID-19 cases and over 32,000 dead, there's been a concerted effort by African countries for access to a vaccine once it's available. The World Health Organization says international donors have so far raised $700 million to purchase vaccines for poor countries. 8 African countries, among them South Africa, Gabon and Namibia, agreed to self-finance access to the vaccine.